So hi, good morning. For today's topic, we're going to talk about the skeletal system. So in order to understand skeletal system, we need to understand the two components that is being formed or connected to skeletal system. So first is the bone. I have the example of a bone. The hardest part in human body. Meron po tayong bone. Another is a cartilage. So I use a glue stick, so cartilage. Not hard as bone, but more flexible and stiff. So yung cartilage po. This is the example of a cartilage. So cartilage can be found in different parts of the body, including joints, knees, and ankle. Now let's talk about the two divisions of a skeletal system. So it is divided into axial, or the central, or the gravity, and the appendicular skeleton. So it's axial, or the center, and the appendicular skeleton. So this is the representation of a skeletal system. The axial, containing skull, the chest, or the chest and the skeletal. So this is the axial skeleton, and this is the appendicular skeleton. So now we're going to talk about the structures of the bone. So first, we need to familiarize with these terms. So concentric lamella, layers of calcified matrix, lacunae, residence of osteocytes, the central canal, a longitudinal canal carrying blood vessel and nerves. Then the bone matrix, non-living structural part of bone, and the canaculi, tiny canals connecting lacunae. So I have here a bamboo to represent the structures of the bone. So the center is the cavity, or the space inside bone, the bone. We have the outer, this outer part is named as the periosteum. And the center, or this part, are the compact bone. And we have the center part, this part is the endosteum. So this is the structures of the bone. So if you're going to use a microscope, so the terms I use, or the terms I discussed a while ago, you can see it in microscope. Now we're going to discuss the parts of the bone. So this part represent the epithelial plate. So the epithelial plate. In this part, the long tube represent the diaphysis. So inside this tube are the compact bones inside this tube. So the cartilage that surrounds the epithelial plate called articular cartilage. So the one coated in epithelial plate is articular cartilage. So inside this border, we can see the spongy bone. So spongy bone. So inside this way, the spongy bone. So the red marrow found this part, the red marrow, and the yellow marrow found this part. So parallel. That's the structures of the bone. Now let us proceed to axial skeleton. First is the skull. So I made here representations of a skull using a coconut shell. So the skull. This is the skull. So before we talk about the skull, let us be familiarized with different terminologies in terms of skull. So number one is the forehead bone, known as the frontal. The cheekbone, known as the zygomatic. The lower jaw, known as the mandible. The bridge of the nose, called nasal. Posterior part of hard palate, palatine. Much of lateral and superior cranium, parietal. Most posterior part of cranium, occipital. Single, irregular bat-shaped bone forming part of cranial floor, sphenoid. Tiny bones bearing tear ducts, lacrimal. Anterior part of hard palate, maxillae. Superior and middle nasal concave form from its projection, we have the ethmoid. Number 12, site of mastoid process, temporal. Site of cilia torsica, sphenoid. Site of mental foramen, ethmoid. Site of styloid process, we have temporal. So we have the ethmoid, we have the temporal, ethmoid for bones containing paranasal sinuses. 1920, we have maxillae and sphenoid. 21 to 22, it coincides articulate with the atlas. 23, middle ear found here. So we have the temporal. 24, nasal septum, boomer. 25, bears at upward, protrusius and caxtomb or crista galli, the ethmoid. So site of external acoustic meatus, temporal. Now let's talk about the terminologies used in skull using the lateral, inferior, and anterior view of human skull. So the lateral form, so as you see the one eye. This is the lacrima. So we start in, this part is the frontal. So this part is the frontal. This part is the squamous suture. And this part is the parietal. Then we have here the temporal. And in this part we have the lambroid suture. This part is the external acoustic meatus. Then the lower part, under external acoustic meatus, we have mastoid process. So the center, in the lower jaw, so dito banda, is the styloid process. We have the mandible. So this part is the mandible. This part is the maxilla. So this part is the mandibular. And we have here the arc. So this part represent the arc. So the lacrima, wherein you can find your eyes. So this is the lacrima. We have here the nasal. So inside the lacrima is the zygomatic. So along with the temporal is the sphenoid. And the divisions between the frontal and the parietal known as the coronal suture. That's for the lateral view of our skull. So let's talk about the inferior view of our skull. So I have here another bamboo shell. So the inferior. So let's start here. This part known as the palatine of maxilla. So this part is the maxilla. Then we have here the zygomatic. So we have here this part. So this part represent the palatine. So this burubutol known as the boomer. And this part is the sphenoid. This part is the carotid canal. This part is the jugular foramen. So this part is the parietal. And this part is the occipital. The black represent the occipital foramen magnum. So that's for our interior view of our skull. So let's proceed to the anterior. Paharap. Nakaharap siya. So this is the frontal. So the frontal. And this part is the coronal suture. This part is the parietal. This part is the temporal. So bandang sentido, temporal. So yung dito sa mata, sa may bandang gilid, yung sphenoid. So dito, sa may bandang gilid, sphenoid. So we have here the boomer. So boomer. Parang boomerang. Boomer. So we have the maxilla. Mandible. Then we have the nasal. We have the zygomatic or the cheekbone. Dito, cheekbone, zygomatic. So the lacrimal. Then the ethmoid. So that's for our skull. So part of axial skeleton. So let's talk about sinuses. So in this part of your skull, the sinuses. There are 4 types of sinuses that we are going to be tackled. The frontal sinuses, so the frontal from this part. The ethmoid sinuses sa lower part of frontal. The sphenoid sinuses sa lower ng ethmoid. And the maxillary sinuses. So what are sinuses? Mucous-aligned air-filled cavities in bone. So that is the definitions of sinuses. So what purpose do they serve in the skull? So ano daw yung purpose ng sinuses? They lighten the skull and serve as resonance chamber for speech. For speech po ginagamit yung ating sinuses. Why are they so susceptible to infections? Why are those susceptible for infection? Their mucosa is continuous with that of the nasal passage into which they drain. So that is the reason why your nasal is susceptible to infection. So we go on now to the second part of axial skeleton, which is the spinal or the vertebral column. So let us first, before we discuss about the vertebral column or the spinal cord, let us talk about some important details or terminologies we are going to use. So structure that enclose the nerve cord known as the vertebral arc. Weight-bearing portions of the vertebra o yung body, yun yung weight-bearing. So provides levers for the muscle to pull against. We have the spinous process and the transverse process. Provides an articulation point for the ribs. We have the body and the transverse process. So provides an articulation point for the ribs. Number 5, openings providing for exit of spinal nerve. We have the intervertebral foramina. So what vertebral columns made of? So let's discuss this different types of bone. Types of vertebrae containing foramina in the transverse processes through which the vertebral arteries ascend to each the brain. So we have the atlas, the axis, and the cervical vertebra. It then provides a pivot for rotation of the first cervical vertebra. So we have the axis. Transverse process have facets for articulations with ribs. Spinous process point sharply downward. So we have the thoracic vertebra. Composite bone articulate with the hip bone laterally. So we have the sacrum. Massive vertebrae, weight sustaining. We have the lumbar vertebra. Tailbone, vestigial fused vertebrae. We have the coccyx. Number 7, we have support the head. Allows the cocking motions of the occipital condyles. So we have the atlas. 7 components and fuse. We have the atlas and the axis. And the cervical vertebra. 12 component and fuse. 12 component and fuse known as the thoracic vertebra. So let's complete this statement. In describing abnormal curvatures, it could be said that kyphosis is an extra-generated thoracic curvature. And in scoliosis, the vertebral column is displaced laterally. So yan po yung mga common illness ng skeletal system. So your skeletal, or the vertebra. In vertebral disease are made of fibrocartilage tissue. The disease provide springiness or flexibility to the spinal column. So let's talk about the different bone found in the spinal column. So first we had the atlas C. So it looks like this. So this part represent the transverse process. So dito nangyayari yung transverse process, yung pag-ikot-ikot. So the space inside known as the vertebral foramina. So ito yung atlas C. So let's talk about the cervical. So this is a cervical spinal. So cervical spinal. So this process, the spinous process. So spinous process. Itong burubutol, spinous process nangyayari dito. So the vertebral foramina. We have here the facet or superior articular process. So dito naman sa bandang part na to, the transverse process. So the next is the thoracic bone. So made up of 3 distinct. So this is the body. So the body. This is the body. So this is the foramina. So this one is for superior, so bandang superior articular process. So dito banda. Sa bandang dulo, nangyayari naman yung transverse process. Pag umiikot. So your spinous process, dito naman nangyayari sa bandang gitna. So ayan. So ito yung thoracic bone. So we have the lumbar. So, ganito po yung lumbar, representation ng lumbar. So the body, the foramina, vertebral foramina. So the spinous process, nangyari dito. The superior articular process, dito nangyari. So nangyari naman dito yung transverse process. So, dito nangyari yung transverse process. So that's for the spinal cord or the vertebral column. So ganito yung representation ng vertebral column. So itong number 6 din sa inyong handbook, color handbook, siya yung atlas. Yung number 7 represent the axis C2. So yung number 1 cervical. Number 2 the thoracic. The number 3 is the lumbar, C L1 to L5. So thoracic naman T1 to T12. So we had number 4 sacrum fused. So sacrum fused. Then we have the number 5 the coccyx fused. So dyan po nagtatapos ang ating topic in terms of spinal or the vertebral column. So let's now proceed to the chest. So before we proceed to chest or the bony thorax, let us first complete this paragraph. The organ protected by the thoracic cage include the lungs and the heart. Ribs 1 through 7 are called true ribs, where ribs 8 through 12 are called false ribs. Ribs 11 and 12 are called floating ribs. All ribs articulate posteriorly with the thoracic vertebrae, and most connect anteriorly to the sternum, either directly or indirectly. The general shape of the thoracic cage is an inverted core. Ito na po yung chest or the bony thorax. So let's talk about. So itong center, this part, the center, known as the sternum. So it is divided into 3. The upper part, known as the manubrium. Then this part is the body. And the burubutol here is the xiphoid process. Xiphoid process. So this part known as the costal cartilage. And this is the ribs. Ito yung mga ribs. So 1 to 7 in both sides represent true ribs. 8 to 12 represent fall ribs. So yan lang po yung dapat nating tandaan sa chest. So we're going to proceed to appendicular skeleton. So I have here example of one of an appendicular parts of an appendicular skeleton known as the shoulder girdle or the shoulder blade. So tawag po dito ay scapula. So this part is the interior angle. So looks like this. So this is the lateral border. We have the lateral angle here, this part. This part represents the glenoid cavity. So may space dito, glenoid cavity. Then this part is known as the acromion. So po, acromion. This part is the coracoid process. And then we have here the superior border. And then we have the shoulder blade here, the superior angle. So dyan po. So let's talk about the bones in hands. The parts of the bones in hands. So we have here the number 1, the humerus. So this part, the humerus. We have here the head. This part represents the greater tubercle. Then the center part is the lesser tubercle. Then we have here the deltoid tuberosity. Then the lower part, we have here the capitulum and the trochlea. So, the trochlea. Then we proceed to another bone. So this bone represents the ulna. So this is your ulna. And this is the radius. So this is the parts in your hand. So let's talk about the parts. Number 1 is the olecranon process. Dito nangyari yung olecranon process. Then here is the trochlear notch. So, and then this is the head. So this is the radial tuberosity. Then the radius. Then the lower part is the styloid process. Nangyari. So another, this is the head and the ulna. So, that's the part of the bones in your hand. Now we proceed to the hands, the bones in the hands. So this part, known as the phalanges. So this part, dito banda, known as the metacarpals. And this part, known as the carpals. So this is the reason why you can move your hands. Because of this bone, carpals. So let us be familiarized to different terminologies in terms of appendicular skeleton. So we have the deltoid tuberosity, raised area on lateral surface of humerus to which deltoid muscles attach. Number 2, we have the humerus, the arm bone. Humerus yung arm bone. We have the number 3 and 4, the clavicle, bones composing the shoulder girdle. So we have the number 5 and number 6, the radius and the ulna, so yung forearm bone. So radius, and ulna. Number 7, acromion, points where scapula and clavicle connect. Number 8, we have the scapula, shoulder girdle bone that has no attachment to the axial skeleton. Number 9, we have the clavicle, shoulder girdle bone that articulates anteriorly with the sternum. We have the glenoid cavity, socket, and the scapula for the arm bone. We have number 11, coracoid process above the glenoid cavity that permits muscle attachment. We have the number 12, the clavicle, commonly called the collarbone. Clavicle. Trochlea, distal medial process of the humerus joints the ulna. We have the ulna, number 14, medial bone of the forearm in anatomical position. Number 15 is capitulum, rounded knob on the humerus that articulates with the radius. We have number 16, coronoid fossa, anterior depression superior to the trochlea, receives part of the ulna when the forearm is flexed. We have the 17, the ulna, forearm bone involved in formations of elbow joint. We have the 18 to 19, the scapula and the sternum, bones that articulate with the clavicle. We have the number 20, the carpals, bones of the wrist. Bones of the wrist are the carpals. Bones of the fingers, phalanges. Heads of these bones from the knuckle, metacarpals. So those are the terms. Be familiarized with those terms for appendicular skeleton. Now we proceed to human pelvic or the articulated pelvis. So let's just discuss the parts. This part known as the coxal bone. This part is the sacrum. This part is the pelvic brim. This part, lower part, we have the ischial spine. This part is the pubic ramus. And this empty space known as the obturator foramen. This center known as the pubic symphysis. The number 8 we had acetabulum. So this part known as the true pelvis. Then this part, the anterior superior iliac spine. So this part from here to here known as the pons pelvic. And then we have the iliac crest. So those are the parts of the human articulate pelvis. So now let us be familiarized with the different terminologies. So we have the ilium, the ischium, and the pubis fused to form the coxal bone or the hip bone. We have number 2, the axial tuberosity receives the weight of the body when sitting. Axial tuberosity. Pubic symphysis, point where the coxal bones join anteriorly. Iliac crest, the upper margin of iliac bones. Acetabulum, deep socket in the hip bone that receives the head and the thigh bone. So acetabulum. We have the sacroiliac joint, point where axial skeleton attached to the pelvic girdle. Sacroiliac joint. We have the femur, longest bone in the body, articulates with the coxal bone, femur. We have the fibula, lateral bone of the leg. So fibula, lateral bone of the leg. Medial bone of the leg. So, tibia. So tibia is the medial bone of the leg. So we have the femur, patella, and tibia, bones forming the knee joint. So bones forming the knee joint, femur, patella, and tibia. Point where the patellar ligament attach tibial tuberosity. So patella, or the kneecap. We have the stiff tibia, the shin bone. Shin bone. Number 14 is the medial malleolus. Medial malleolus. Distal process on the medial tibial surface. Lateral malleolus, process forming the outer ankle. The heel bone or the calcaneus. So number 17, bones of the ankle, tarsals. Bones forming instead of the foot, metatarsals. So metatarsals. Opening in a coxal bone formed by the pubic and ischial rami, obturator foramen. Sites of muscle attachment on the proximal end of the femur, greater and lesser trochanterus and glottal tuberosity. Tarsal bone that articulates with the tibia, we had the talus. That's all for the familiarizations of the lower part of the appendicular system. So from pelvic down to your foot. So now let's talk about the human leg. So this is examples of human leg. So we have here the femur. So this is the femur. I discussed the parts of the bone. So we have here the tibia, and the fibula. So let us now discuss the parts in the femur. So this is the head. So this represents the head. So ganito. Ganito yung head niya sa femur. This represents the head. And then we have the neck. Then the lesser trochanter. Then the lateral condyle. So we go now to the tibia and fibula part of your leg. So this is the medial condyle. We have here the lateral condyle. This is the tibial tuberosity. So the anterior border. The medial malleolus. And the lateral malleolus. Medial malleolus and lateral malleolus. So those are the parts of the human leg, or the bones in the human leg. Now let us locate the different parts of the bone in terms of axial skeleton or appendicular skeleton. So we have the frontal is for axial, we have number 1, and the appendicular is number 2. So frontal is number 1, maxilla is number 1, mandible is number 1, sternum is number 1, rib is number 1. We have the radius, number 2. The sacrum is number 1. We have the ulna, number 2. Carpals, metacarpals, phalanges are number 2. So we have the tibia and fibula, number 2. The tarsals and the phalanges, number 2. So we have here the talus and metatarsals, number 2. We have here the patella, number 2. We have the femur, number 2. The coxal bone, number 2. The vertebra or the spinal cord, number 1. Number 2 is the humerus, number 2. We have here the scapula. So we have here the scapula, number 2. The clavicle, number 2. And the occipital and parietal is number 1. So that's how we distinguish the parts of the axial and appendicular skeleton. So let us now talk about the bone fracture. So when the bone looks like this, so the fracture known as the green stick fracture. So green stick fracture. So usually nangyayari siya kapag nataga ka, so hindi naman naputol yung buto mo, so nagasgasan lang. So ang tawag doon ay green stick fracture. So kapag inside, nagkaroon ng bali, so nabali inside. So ang tawag ay simple fracture. Simple fracture. Kapag naroon na naman ang bali, tapos lumabas na sa balat, so na-damage na yung skin mo, so ang tawag na doon ay compound fracture. Compound fracture. Compound fracture. Sa ulo naman, sa brain, so sa skull, usually, ang tawag doon ay, pag nayupi, kung nagkaroon ng deformities in your skull, tawag doon ay depressed fracture. Now let's talk about the joints. So, joints are the connecting mechanism of the skeletal system. So without the joints, our bodies are not connected. So this is the example of the joint. So this is the reason why you can bend your knees. So let's talk about the parts of the joints. So this part is the fibrous capsule. So inside your joint, the space here known as the articular cartilage, and the membrane or tissue at the center of the articular cartilage known as the joint cavity. So joint cavity. So the one that surrounds the articulate cartilage and joint cavity is the synovial membrane. So those are the responsible. So let's discuss this. Synovial fluid, the lubricant that minimize frictions and abrasions of joint surfaces. So articular cartilage, the resilient substance that keeps bone ends from crushing when depressed. So we have the ligaments, which reinforce the fibrous capsule, help to prevent dislocation of the joint. So ligaments or fibrous capsule. So that's all for the skeletal system. So I hope you learned something for our today's lesson. So thank you and have a good day.